Many studies exploring speech in young children with Down syndrome have shown that expressive language abilities tend to be relatively delayed for children with Down syndrome compared to typically developing children, but there are huge individual differences in these patterns. As young children learn so much of their early language from interactions at home, looking to the home speech environment might help explain why we see so much variability. Language Environment Analysis, or LENA, is a small device that automates audio data collection and processing. It's been validated for typically developing children up to 48 months, and large cohort studies have shown that child vocalizations increase with age, but the amount of adult speech that children hear tends to stay constant for typically developing children. However, there are few similar studies of LENA measures for children with Down syndrome. To explore how the home speech environment of children with Down syndrome changes with age, and whether it can explain the variability in expressive language, LENA data from 71 young children with Down syndrome was collated from two previous studies, one with toddlers and one with primary school children. To complement the LENA data, standardized scores from the Vineland Adaptive Behavior Scales, a parent report questionnaire, were calculated. The expressive and receptive language and the gross and fine motor scores were chosen for the analysis. Contrary to typically developing literature, age did not predict the number of child vocalizations. However, there was a trending relationship between the adult word count and age, but only in the older sample. The reason for this trend and for the change from typically developing literature is unclear and should be explored further. So what about explaining variability in expressive language? Typically developing literature suggests that the more speech children hear, the more they vocalize, which in turn is linked to expressive language abilities. However, the data showed that adult word count didn't explain the variability in child vocalizations. Further, neither child vocalizations nor adult word count explained the variability in expressive language scores. As the amount of speech in the child's environment didn't explain this variability, we started to explore other features of the environment that might affect expressive language. We chose to examine children's motor abilities because both gross and fine motor have been linked to language in typically developing children. We also controlled for receptive language, as understanding language would be expected to predict language production, a result which is shown in Model 2. Model 3 also showed that fine motor scores are a significant predictor of concurrent expressive language abilities, and a model including fine motor scores explains significantly more variability in expressive language than a model without it. Moving forward, we'll compare the LENA measures of speech environments of children with and without Down syndrome to see if they differ on measures such as quantity and quality of speech. We're also collecting head camera data that will let us relate children's speech environments to their daily fine motor interactions. The data will also let us explore the role of other interactions with the environment, such as gross motor and vision. We plan to use this data to examine which speech and sensory motor features of daily experiences may explain variability in vocabulary size for young children with and without Down syndrome.